Hello, friends. Today I'm going to be talking about the pharmacology drugs for cardiology, part one. So, all the drugs that we cover today are going to be for hypertension. So, we're going to start with our ACE inhibitors. So, in this picture, we have a flying ACE, and he is being inhibited by this laser or ACE inhibitor drugs over here. So, we have lisinopril, fosinapril, and enalapril. And so, like I said, this is a fossil for fosinapril, and then this fossil is a tooth. Teeth have enamel, so enalapril, and they are shooting a laser beam. Laser and lisinopril kind of they both start with L's. So the laser beam shot down the flying ace. He's now falling out of the sky. So the mechanism of action is to inhibit and the angiotensin converting enzyme, that's what ACE stands for, which will then in turn lower angiotensin 2, which would then lower aldosterone, which would then decrease blood pressure. So adverse effects are hyperkalemia. So we have our banana for high potassium, hypotension. So think about how he is falling out of the sky as he's dropping, the pressure, the air pressure is getting lower and lower, just like his blood pressure is getting lower. We also have adverse effect of angioedema, so his lips are pretty swollen in this picture. He's got a cough, and then renal dysfunction is shown here on the wing. So next we'll move to the angiotensin 2 receptor blockers, or ARB. So we have two angels for angio 2, and then we have Satan down here because the drugs in this category they kind of look like they end in the word Satan or Sartan. So we have low Sartan because Satan lives a pretty low life, and then valsartan for like Valentine, hearts, things like that. So the mechanism of action is that it blocks angiotensin 2 receptors so that ACE can't work on those receptors. So if ACE isn't working, well, then we have the same effect over here where then angiotensin 2 doesn't work, and then aldosterone doesn't work, and then it lowers blood pressure. The adverse effects are, again, hyperkalemia, so our banana, hypotension, again, they're in the sky, low blood pressure, angioedema, Satan's lips are, I tried to make them look like they're swollen here, and then renal dysfunction, this angel has her kidneys fallen out. And then a key point is to not combine ACEs and ARBs, and I wrote that they fly solo. So that's a good way to help you remember not to combine ACE and ARBs, because the ARBs, they have wings, so they can fly. And the ACE, he's got his plane here, so he can fly, so he doesn't need any wings. And they don't need planes because, like I said, they already got wings. So they don't need to be combined. They can work separately on their own. So then the next couple drugs were just in a category labeled other. So we have aliskiren, which I thought looked like the word Alaskan. So we have an Alaskan husky. And what this drug, I'm not gonna lie, this is not a great picture, but this drug inhibits renin, which then reduces the conversion of angiotensinogen to angiotensin 1. So what I was trying to get at in this picture is this husky, he's trying to run, so run renin, but he's being inhibited by whatever this weight is. Like there's a lot of tension on this line. So just kind of, I don't know, put it all together and remember renin for running, and he's being inhibited. Adverse effects are still hyperkalemia, renal dysfunction, cough, and angioedema, which are not, the renal dysfunction and angioedema are not shown. Then the next drug is known as Entresto, and this one's a little bit different from the other ones. So it's used in congestive heart failure when patients have a low ejection fraction. And so the mechanism of action is that it is a neprilysin inhibitor, which metabolizes atrial and brain natriuretic peptide. So just to explain the picture, we have this person who's entering nature. So entering, so Entresto, nature for natriuretic peptide. So let me explain this a little bit better. So the brain natriuretic peptide, also called BNP, is produced by your heart and basically tells your kidneys to promote sodium secretion, lower the blood volume, and relax your vessels. So, and that's just, it's telling your kidneys to decrease blood pressure. But we can't have BNP be high all the time, otherwise we'd always be hypotensive. So we have this enzyme in our body called neprilysin, and its job is just to break down the BNP molecule. So with this drug, we are inhibiting neprilysin. I don't know why I can't say that. And so that means there's more BNP that's circulating around in the system, and therefore it's keeping your blood pressure low. So that's how that works. And the adverse effects are the same as over here. So hyperkalemia, renal dysfunction, cough, and angioedema. So next we'll move on to our beta blockers, which we have discussed before. And so mechanism of action is that these block epinephrine and norepinephrine at beta 1 and beta 2 receptors. So again, we have our propane tank with the beta fish to help you remember that it's a beta blocker. For propanolol, we have a label for labetalol, this carved totem pole here for carvedilol, and then the Eskimo for esmolol, and then this metro train for metoprolol. So our adverse effects are bradycardia, hypotension, which are shown here, erectile dysfunction, and wheezing. And just to make sure that we all understand this, I'm going to go through this real quick. So remember, in a normal patient, if you are, say, walking through the woods and a lion jumps out at you, your body's going to release epinephrine. It's going to work on beta 1 and beta 2. In beta 1, it's going to bind to that beta 1 receptor, and it's going to increase your heart rate and contractility. Epinephrine is also going to bind to beta 2, which is going to be in your lungs, and it's going to bronchodilate so that you can get more air and run away from the lion as you're running. So with beta blockers, when these receptors are blocked, your sympathetic nervous system is not getting through, which is why we have bradycardia, the hypotension, and then especially the wheezing, because beta 2 is being blocked. And so rather than your lungs and your bronchus dilating, it's staying constricted. So that's why we have the wheezing going on there. Next, we'll move on to our alpha-1 adrenergic antagonists. So the drugs in this category are doxazosin, prazosin, and terazosin. So this is a dachshund or dachshund for the doxazosin. This is a terracotta plant, a terracotta pot, which if you're not familiar with, it's just the type of clay that the pot is made out of. And then just pretend this is like a primrose or any other plant that you can think of that starts with the letter P to help you remember prazosin. And then we'll ignore this one for now. So mechanism of action is that it blocks alpha-1 receptor, which relaxes your vascular smooth muscle and then your urinary sphincter, which is why the dog is peeing. And these cause, for adverse effects, can cause orthostatic hypotension or just normal hypotension, but I just wrote orthostatic hypotension. So then going over here to this other drug, which is Flomax or tamsulosin. but I remember Flomax because the urine is flowing. This also blocks alpha-1 receptors, which relaxes the urinary sphincter. However, it does not have the same effect on the smooth muscles as these other drugs. So it doesn't change their blood pressure at all. So that was a drug that was used with people who have like prostate enlargement, I believe. So next we'll move on to the alpha-2 agonists. So here we have two cloned iguanas. So they're cloned to remember clonidine, and they're iguanas for guanafacine. Now I've used iguanas in drawings before, and so this time I only used the face of the iguana for, again, guanafacine. We also have methyldopa or aldomet over here, and so we have Waldo, and he's like, hi, nice to meet you. And so then you're like, oh, I met Waldo today, aldomet. Mechanism of action is to reduce outflow from the CNS, which I'm assuming that that means that you're reducing like the amount of epi and norepi that's being released, and therefore you would have less response, you know what I mean? Anyways, oh, and by the way, Waldo's smoking dope for dopa. Back to this. So adverse effects are not really shown in this picture, but I guess if you thought about iguanas being lazy, sleepy, slow-moving creatures that live in a dry area, then that might help you. So we have dry mouth, hypotension, urinary retention, which I don't think that's spelled right, and somnolence, which is the excessive sleepiness. Okay, moving on, we have our calcium channel blockers. So there are two subcategories in the calcium channel blockers. So we have our non-dihydropyridines and our dihydropyridines. So we have pyramids for pyridine, and then this one is dyed for dihydropyridine, and this one is not for non-dyed. All right, so the non-dyed, these ones, we have an aloe vera plant for verapamil, and then we have this pyramid is tilted for diltiazem. So I think the word dilt, like the beginning here looks like dilt. It's like looks like the word tilt, so that's why it's tilted. And then over here for the dihydropyridines, we have, first of all, a big pine tree, because all of these end in pine or pine. And so we have a knife for nifedipine, and then a cigarette or nicotine for nicardipine, and then a clock that says AM, it's in the morning, for amlodipine. So the mechanism of action is obviously that they block calcium channels and prevent calcium from getting into the cell membrane. Adverse effects are, for over here, dizziness, edema, headache, constipation. None of those are shown in the picture. And then over here, again, we have dizziness, headache, edema, flushing. That's why there's a toilet. Tachycardia and rash. So I guess if you thought about if this toilet was to flush and it was spinning around in a circle, it would probably get pretty dizzy. And if this alarm clock was like ringing super loud, it'd give you a headache. So next we'll move on to our thiazide diuretics. So in this scene, we have this girl, she's on a tube and she's floating down like one of those lazy river things. And she's by a meadow in India. And so the drugs in this category are metallazone, or a meadow zone, because this little area or zone here is a nice little meadow. They're, like I said, they're in India for indapamide, and then she's got big thighs. At least I was trying to draw big thighs. And so we have, and this one's wet, this one's not. Also, if you think about lazy rivers, they're usually chlorinated. So we have hydrochlorothiazide, so a water like wet on her thigh, hydrochlorothiazide. And then you just have chlorothiazide. So this thigh has just nothing on it, just the chlorine, whatever. Okay, mechanism of action. Inhibits sodium reabsorption in the distal convoluted tubule. So again, she's on a tube to help you remember tubule. And then if you think maybe she's in the distal aspect of this, if saying like over here is like the beginning and now she's moved through it and she's kind of at the end, the distal aspect. Adverse effects are hypokalemia. So there's not a banana in this picture, right? Because hyperkalemia is the banana. And then renal dysfunction, that's not shown. Neither is dehydration or hypotension, but hypotension and dehydration are in like everything. So just remember that. So next we'll move on to our loop diuretics. So we have this kid here, he's blowing bubbles with a loop. So that will help you remember that that's what this drawing is for. And there's two different subcategories again. So we have our sulfonamides, which are over here, and then our non-sulfonamides, which is this kid. So we'll start with our sulfonamides, which is, we have a torch for torsamide. And then here we have a cat who's licking his butt. So cats are furry for furosemide, and then he's licking his butt or his bum for bumetamide. I'm sure that's not how you pronounce it, but bum, you get it. Mechanism of action is to inhibit calcium reabsorption in the ascending loop of Henle. We can just pretend that this cat's name is Henle. And I don't have any other way to remember the rest of this. Again, adverse effects are hypokalemia, renal dysfunction, dehydration, hypotension, all the same things that are in like the other stuff. And then here we have Ethan, and he's crying for ethocrinic acid, which is a non-sulfonamide, and he's crying because he's not like he can't sit on the sofa because the cat is on there. So sofa, sulfonamide. These adverse effects are all of these plus hyponatremia and metabolic alkalosis. Next, we have our potassium sparing diuretics. So this one's kind of a mess too. We're going to pretend that we're at a sawmill. So we're sawing some wood, and at the end of this log is this spear for sparing or spearing potassium. So there's a banana at the end of it. And then you have sodium. Because the mechanism of action is to inhibit sodium and potassium ATPase pump in the distal convoluted tubule and collecting duct. And so it keeps sodium in the distal convoluted tubule and keeps potassium in the interstitial fluid. So the reason why we're at a sawmill is because of a milleride. And this little collecting duct here that's collecting sawdust will kind of help you remember the mechanism of action. And by the way, we're doing all of this at 3 a.m. because tri-AM pterine or triamarine. Nope, that's not right either. Whatever. The adverse effects are hyponatremia and, hang on. For amiloride, you have hyperkalemia and hyponatremia. For this one, you just have hyperkalemia. Also, I think it's funny because sawing wood is like slang for snoring, and you'd probably be snoring at 3 a.m. Also, this banana looks like the moon. Moving on, we have our vasodilators. So minoxidil, we learned that before for dermatology. And then hydralazine. So, by the way, this is amino-ox for minoxidil. And this is a hose or a hydrant for hydralazine. The mechanism of action for these is just that they work right on the arterioles and dilate them. Adverse effects for minoxidil are hair growth. That's why we learned it in derm. And then EKG changes, angina, and pericardial effusion. So this little minnow ox looks like maybe he's clutching his chest. So just heart issues, basically. Adverse effects for hydralazine are hypotension, and then drug-induced lupus. That's the biggest one. And then we'll go on to this one, which this one's really far-fetched as well. So when I read nitroprusside, I just saw the word like prus or prus, and I thought of like a pussy cat. And so that's what this is. And he's saying no, because he doesn't want to get wet because cats don't like water. And the mechanism of action is that it increases nitric oxide, which is abbreviated as NO, no. So it increases nitric oxide production, which then relaxes vascular smooth muscle and dilates coronary arteries. And hang on a second, there we go. Adverse effects are brady or tachycardia, hypotension, cyanide poisoning, and methemoglobinemia, which is when your body cannot take in oxygen into the cells. And then lastly, we have our aldosterone antagonist diuretics. So mechanism of action is just that they're an aldosterone antagonist. And so we have our spiral that's drinking milk for spironolactone. And then this is supposed to represent someone with epilepsy for eplerenone, that's an E. Adverse effects are hyperkalemia, hyponatremia, and gynecomastia. And that is the end of this video.